Hello, good afternoon. Before anything else, I'll do the procedure, which is the removal of the staples and chains tracings. So I'm gonna introduce myself first. My name is Ivy Luzon das Cabralius, and this is my complete uniform with my shoes, white here, and this is my ID with my student ID number is 3822292 3822292. Now, before I proceed for the procedures, so I'm gonna wash my hands first to maintain the sanitations or hand hygiene, I mean, and then after my hand hygiene, I'm gonna read the scenario and then the doctor's order. This is the one. So I'm just highlighting the scenario to minimize the time consuming of my of the return demo. Okay, the scenario is the patient's name is Michael Jordan. He has having fracture on his and his tibia and fibula on his right side of his leg, and then the current situation is to remove the staples. Now, after reading my scenario, I will verify the doctor's order. This is the doctor's order, and this is the back of the doctor's order. I want to show you that the back is not written at the back. Now, I'm gonna read the scenario, the doctor's order, Bow Valley College Hospital, 332 6th Avenue Southeast, Calgary. MRN is 125-2569. His room number is 701. Patient's name is Jordan Michael. Then he is known to allergies. Then his gender is male. Date of birth is 1985, August 31. And then his physician is Susan Hale. So physician's order as follow. Today's date, October 15, 2020 at 1100 is to remove alternate staples from right leg today. Apply sterile strips and cover with the sterile 4x4 gauze dressings. Remove the remaining staples tomorrow, signed by Dr. Susan Hale. Then 13 days ago, at 900 hours, that was October 2, IV, doctor's order is intravenous normal saline TKBO, and then IV ciprofloxacin 2 grams every 8 hours times 7 days, signed by Susan Hale, Dr. MD. And then 14 days ago, 1800 October 1, admit to surgical unit, vital signs Q 15 minutes times 1 hour, then Q 30 minutes times 1 hour, then Q 1 hour times 4 hours, then every 4 hours. Then cleans right leg incisions with normal saline, wipe dry with sterile gauze, and cover with sterile dressings daily. Polycatheter to gravity drainage, remove when drinking well. Activity is bed rest, then keep right leg is elevated. IV normal saline at 125 ml per hour. Discontinue when drinking well. Then oxycodone 500 mg with acetaminophen, 325 mg, 2 tablets every 6 hours PRN for pain. Then morphine injections, 5 to 10 mg subcutaneous or IV PB or intravenous piggyback or intramuscular every 4 hours PRN for pain. Then dimenhydrinate, 25 to 50 mg IM or intramuscular IV PB every 4 hours PRN for nausea and vomiting. And the last is magnesium hydroxide per orin 30 ml PRN daily for constipations. So that's my verification. That's my verification for my doctor's order. Now, I'm gonna wash my hands to prepare all my materials needed. So I'm gonna wash to maintain the the hand hygiene. So now this is my blue underpad. Then this is my sterile dressing tray. Assuming this is not yet open, and then there's it not says here that the expirations date. No expirations date. Now, this is the staple remover sterile. Assume it's not yet open. Then in the expiration is July 10, 2023. Then this is my normal saline solutions, assuming this is open already. So zero point 0.9 sodium chloride for one dressing. Expiration date July 2021. Date open is October 14, 2020. That was yesterday at 1800 hour. So this is still good because it's not yet 24 hours. Okay, I have the 2x2 and 4x4 sterile gauze, assume it's not yet open. And then I have here sterile strips, it's open already, assume it's not yet open. And then the expiration is 2024, month of August. I have the plaster, I have the rest ID for the patients. I have the clean gloves, my hand sanitizer, my Lysol wipes disinfectant to clean up my table later. Then assuming this is my sharpeners container. Now, so now that assuming, so I'm gonna bring this one everything to the patient's room. Now I'm gonna knock the door. Knock knock. Hi Michael, good afternoon. My name is Ivy. I am your practical nurse today. I'm here to remove your staples, and I have to change your dressing. By the way, how are you? Are you good? He said yes, I am good. And okay, can you state for me your family name and your date of birth, please? He said that his family name is Jordan and his date of birth is August 31, 1985. So I will verify, or then this one read the wristband, the wrist ID, and then the doctor's order. The name is Jordan Michael. Hospital number is 125-2. That's 2569. Then the gender is male. Date of birth is 1985, August 31. And then his room number is 701. And his physician is Dr. Susan Hale. Now, because I'm done verifying, so I will put away my doctor's order. Okay. Now, so I'm here already. So I will position my patients, and then I will sit up properly, raise my table, and then the bed of the patient in the waist height and the waist level of on my waist level, which is the waist the height working the height working. Now, so I will assuming this is the table is at my waist and my waist level, and then I will assuming the bed I raise up already until my waist level. And then this is my right hand, and then this is my left. So my right hand, assuming this is the head of the patient, and then the left is the legs of the patients. Now I'm gonna position my patients into side lying positions, facing towards away from me, and then I'll make it sure that I will expose only the incision size or the dressing area. So the dressing wound area. Now, so I will put the what you call this, the I will put the pillow under his knee, his legs, to make him comfortable. Michael, are you comfortable in a side lying position? He said yes. Now, after that, so I will ask him, Michael, are you in pain right now? He said no. So if ever the patient will say it is in pain, you have to administer medications 30 minutes before the procedure as per doctor's order. And also you have to ask the allergy if he is known for allergy. Michael, do you have any allergy? So he said no, he doesn't have allergy. Now, so after that, so after positioning the patients, so all my materials is here already. So what I'm gonna do is to remove the old dressings. So before that, the old dressings, so I'm gonna wash my hands for everything. By the way, for the pain scale is 0 is no pain, 5 is moderate, and then the 10 is worst pain. That is the pain scale. So now I'm done washing my hands or sanitizing my hands. So I will put clean gloves when before I remove the because as a protocol of the institution, when you remove all dressings because it's already contaminated, it's dirty, right? right? So you don't need to contaminate. So you have to clean the you have to put clean gloves. So now I have the clean gloves now in my hands. Now I will remove now the one dressing. So I will remove it slowly. Start from the top going down. So I will remove this one slowly, 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 slowly. Now my dressing, and my drainage is clean. Is not, there's no drainage, and then the dressing is intact. The wound is intact. So I will assess now the wound. So the wound is no redness, no edema, no ecchymosis, no drainage, and then the approximity. So now if ever there's there is a drainage, you have to take note the serous, the purulent, and also the sanguinous, and then also the how the quantity and the percentage or the amount of this of the drainage. If it's 20, how soaked it is, 25%, 50%. So you have to and also to mention it, and then you have to take note also the color of the wound, and also have to make also the okay, consistency of the wound, I mean. Okay, so next is, since this is all this is dirty already, so I'm successfully, so the scenario is clean, not clean, it's no drainage. So I will destroy this one, discard this one to the garbage. I will remove my right gloves in my right hand using my left hand gloves. So this one. So I will touch underneath of my left gloves. So and then discard, remove, I mean, and discard. So I will discard this one, then put in the garbage. I have garbage in my left side in my foot. Now after that, I will wash my hands to maintain the hand hygiene. Okay, now so assuming assuming that I have on my hands the tape measure, in order to I will measure the sizes of my wound. So it assuming it is 1.5 to 2 centimeter inches long. Now I'm done on removing all dressing. So what I should do is to clean the dressing, to clean the ones, I mean. So what should I do? So I would clean up first my table, but my table. Okay, so using my disinfectant wipes. Okay, I will disregard this one, and then I will put my underpad below the legs of my clients, or my patients, I mean. Okay, so after that, so this is the positions of my what you call this, table, a working table. Now I'm gonna grab my dressing tray. So there's no assuming it's not yet opened, and then there's no expiration date. It says written here. So I'm gonna open this one now, the sterile dressing tray towards me. So this is it. Okay, so this one I'm gonna put it here. So I will pick up the green forceps. Then I'll make it sure that you won't touch anything at the top of the sterile dressing tray. Okay. Now what I'm gonna do is to pick up the purse strip. I will use the purse strip because just in case I have something wrong done with my purse strip, I can still use the second. What I mean, I think I touched already my purse strip, so I'll discard this one. So I'm gonna use my second strip. So I will make it sure that okay. So this is my second strip. Okay, I will touch the other edges of the strip, and then I'll show it to you that I'll make it sure that the shiny is under or the top of the table. Okay, now I'm gonna pick up the garbage. So I'll just put it here. Okay, next is I'm gonna pick up the pore by pore, the sterile pore by pore. Here, okay. By the way, before I forget to mention, so I would mention it now that the quarter inch of the drip is considered contaminated. So I will make window to where I so that that's my where I should go when I put the all materials that I need to put in the set of the sterile drip. So then that's the sign that I would not limit my crossing the sterile to maintain the sterility, the principle of sterility. Now, so I'm gonna pick up the forceps. This is the forceps. Okay, here I'm gonna do this one like this, and then the other forceps too. Here. All right. Now the 2x2 I will not pick it up. I'll just remain in the dressing tray. Now so this one I'm gonna put this one the green porcelain at the what you call this at this side. So remember when I touch this one and then that quarter is considered already contaminated, and make it sure that the tip of the pick up the green tip forceps is maintain the sterility. Now what I'm gonna do next, so I'll put this one my garbage at the side, this one. Okay, so here. Okay, so I'll just successfully. Now I will grab my normal saline. So as I mentioned earlier, I will mention 3 times to 3 checks. Normal saline 0.9% sodium chloride for 1 dressing. Normal saline 0.9% sodium chloride for 1 dressing. Normal saline 0.9% sodium chloride for 1 dressing. Expiration date July 2021. Expiration date July 2021. Expiration date July 2021. So the date open, it was yesterday, October 14, 2020 at 1800 hours. So I will open this one now. So since this is open, so I'm gonna pour a little bit here on my garbage here. And then I will pour. I will pour in the dressing tray. I'll make it sure that the tip won't touch the dressing, and then I make it sure that not too high, not too low when you pour the normal saline solutions. Okay, so I will cover this one. So now, since that I'm done putting the pot is sterile. I set up already the sterile pill. So I'll make it sure that I will not turn back of my sterile area, because it's gonna be once I turn back, it's considered non-sterile already. Now, so I'll do now one dressing. I will clean up now the one. So I'm gonna pick up the green forceps now, and then pick up my 2 forceps. So I'll do backward and then move forward a little bit. Then pick up the forceps, and then the other one. So this one here. So this one. Okay, so this is my 2 forceps. So I just want the tip. I will pointed downward to maintain in this position is to maintain the sterility, the principle of sterility. So now I'm gonna soak my 2x2 to the what you call this, to the this one solutions. Okay, now, okay, this is my soak. Okay, so I'm gonna clean up now the wand at the center first. So I'll maintain the wand. I will clean up the wand, the center first, then from the top to the down in a 1 stroke. and then discard, then pick up the other one and then soak it. So what you're gonna do is, okay, it's here. Okay, I'm gonna clean up far away from me. So start from the top, going down in one stroke. Okay, discard. So next, pick up the third one. Then you have to clean the near towards me. Okay, so I'm gonna maintain the positions like this, pointing downward. Clean the nearest towards me from top to bottom, then in one stroke. So, and then discard. Okay, now I will dry the wand. So there are two ways. So let it dry by air, or you can dry it to the sterile through the sterile gauze. So it's up to you. So assuming that is air dry already, and then this one, so the tip is already wet, so I let it dry, and then I will put away here at the side, just in case I will use this one later on. Okay, here. All right, now, so assuming that I've done cleaning the wand, then I did already the assessment of the wand. So what I'm gonna do now is the staple removal. Now before the staple removal, I will do wash my hands, because I will use not sterile gloves, the clean gloves, as a protocol that you have to wear gloves when you remove the staples. So I will put my clean gloves now. So this is my clean gloves. Okay, now so I will remove the staples. So now what next is I'm gonna grab my staples remover. Now the staples remover is sterile. It will expire on July 10, 2023. So I will open this one like when you peel a banana. So I'm gonna open like this. So I will grab this one. Okay, I will grab this one. Okay, so this one, so I'll just put it here because I'm gonna use this one when I remove the staples. Now, so these staple removals have one teeth, and then the other one is one teeth only. So the two teeth should be under the staples. So okay, now I'm gonna go. I will remove the two staples, which is the second one and then the fourth one. So the remaining, it will be removed tomorrow. Then you have to inform the patients for that. Okay, so now what I'm gonna do now is to the two teeth is under the staples like this at the center. Okay, at the center. Then pinch. Okay, then gentle wiggle, 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 and now is this one is removed. So I'll put this one here. Now next is the fourth one. So under the two teeth is under the staples, then pinch, slowly wiggle, wiggle, wiggle. Okay, so okay, I'll just put it there. Okay, this one. Okay, then I remove that one, then I'll put it here. So I will, so since I removed two staples, so I will count this one. So it's 1 and 2. Then I will also count the remaining that the staples remain in the one and the okay, 1, 2, 3. Now I will tell the patients that the remaining staples that would be removed tomorrow. Hi Michael, by the way, you still have 3 staples remain in your wound, so this will be gonna be removed tomorrow. He said yes. Now this one, so I'm just gonna discard this one in the content on the sharp container. So this one, so just in case later on if I still need it, so I'll just put it here at the bed sides, at the sides. Now next is, so I'm done removing the staples. What I'm gonna do is to put steri strips, apply steri strips. So I'll grab this one. So assume it's not yet open, so the expirations for this is 2024, the month of August. So still you have to open like a banana peel, right? So assuming this one. Okay. Okay, I'll just remove this one because I removed 2 staples. This one. Then I'll put it here. So assuming that it sticks. Sorry, it's not. It won't stick. Okay, it is stick. Alright, thank you. Okay, now I'm gonna remove my gloves. Okay, I will wash my hands. Okay, so by the way, I will do this one. Okay, open, pick up this one with this one. Okay, we return this one. Okay, now I'm gonna take a plaster, make window. Assuming it was, I'm successfully putting the window, plastering. Then, okay. Now, after this, I'm gonna write this one. So assuming it was already stick. So I will write the date today, October 15, 2020, 4 p.m. and then I will sign. So assuming I write it already. Now, so I'm done with the procedure. So what I do next is I will sanitize my hands and I will discard everything for my materials. So the sharp container, I mean the sharp objects, so I'll put in the sharp container. And then the rest is in the biohazard material, biohazard garbage. So this one and the sharp container, this one. Okay. So I will remove everything here. So put in the. Okay, so next is I will give health teachings. So first is you have to instruct not to scratch, not to wet the wound to prevent infections. Then instruct to eat healthy foods, especially rich in vitamin C, to promote wound healing. And next is you have to you have to tell them that if it is in pain, there's a drainage, so you have to report to this is a sign of infection to address the problem. So I will remove my gloves now and then wash my hands, and then make it sure you have to lower the bed and then reposition the patient in a supine position. Ask Michael if he's comfortable. Michael, are you comfortable? He said yes. Next is you have to side rails and then make sure the belt is he can reach easily. Michael, can you reach the belt easily? He said yes. Now after that you have to documents later on the procedure what you did. So before leaving the room, make it sure that it's clean everything, and then you have to wash your hands to maintain the hand hygiene, and that's it. So have a nice day and good afternoon and stay safe everyone.